Hey, this is Dr. Jason Torado, your West New York chiropractor, and today's health care alert is going to be one of the first in a long line of healthcare alerts that are going to be on whiplash and car accidents. Because I really feel that they're important, and because some of you out there in YouTube land have actually asked for it. So let's get started with our healthcare alert number 1 on whiplash and why it's so different from other types of injuries. You know, whiplash really is a lot different. Whiplash accidents to the neck actually are much different than other types of injuries. You know, when an accident in a car can be extremely severe, sometimes the pain can come on right away. And a lot of times if the injury produces a mild or a moderate sprain, then sometimes it takes a few days for the pain and the inflammation to actually reach its maximum. And sometimes the stiffness, right? Stiffness inside the joint, that's usually the prominent symptom that the patient notices, usually within the first few weeks, typically after the accident. I mean, that's usually the pain that brings them into the office, right? But a lot of times the delay in pain from a car accident is usually often seen in these low-speed car accidents, where typically there's a very little damage that occurs to the motor vehicle. But yet, still a bad injury can occur to a person's neck, even if it's a low-speed car accident. You know, there are a lot of factors that actually determine the extent of the injury following one of these low-speed car accidents, and one is specifically neck posture prior to the impact. Was the head turned at the time of impact? You know, that can typically occur if, let's say, the patient was looking into a rearview mirror and suddenly got smacked into the in the car. You know, a lot of these low-speed car accident collisions that cause damage to your neck can even occur in something like a parking lot traveling at very low speeds. In fact, sometimes those are the worst. For example, you know, if you're getting into an accident, for example, getting into an accident while you're turned like this, right, and then getting hit from the side will cause your head to jerk like this. That can cause tremendous and significant injury to the neck. So besides the position of your head, prior to the collision, also the speed and the amount of speed that the vehicle is traveling are usually going to be a good criteria for the severity of the trauma and the damage that you're going to get inside your neck. However, you know, that it kind of changes because of these things called crumple zones inside a car. A lot of these cars, brand new cars, have crumple zones in their cars or built into them. And most cars that are after 2005 are going to have these crumple zones built into their car. You know, these are the areas inside the car where during the collision it absorbs most of the energy from the impact. And in some like low-speed car accidents, there's usually less crumple and more of the force is typically transmitted to the person or the occupant that's inside the car. You know, this is actually just but one of the reasons why many vehicle damage doesn't always equate to the amount of spinal injury, because you could have very little damage and you could have a huge amount of injury to the person that's inside the car, and it wouldn't even look like it's a bad accident, or it wouldn't even look like there's a lot of injury to the person because there's very low damage to the car. You know, another factor in a whiplash car accident is whether the headrest, right, let's say this is your headrest, was properly positioned, right? So a proper headrest should be close to the neck, so it should be right around there, right? So it should be close to the top of the head, right? And at a high point, just like, let's say, right above the head. I'm going to show that to you again. Like right here, right about there, supporting the head. And the reason for the high position is that in a rear end collision, the patient who's being hit will typically rise slightly like this, right? Rise slightly with the impact. And if the headrest is way too low, then the neck will bend around the cushion, sort of like a fulcrum, causing even more injury. So it'll look like this. The headrest will be here, and during the accident, it'll come up, and then your neck will go like this. And sometimes that wraps around the headrest, and that causes creates a huge amount of force on the neck. Right? So that can be tremendous. That can cause the tremendous amounts of injuries. So, you know, because a lot of these symptoms can come on real slow, and minor vehicle damage is not typically a good indicator of the injury, I always recommend to all of my patients, you know, a thorough examination, a true thorough car accident examination for all of my patients. It's extremely important. And remember, it's always important to be checked by a competent healthcare provider after any type of motor vehicle collision. And so if you've been in a motor vehicle accident and you've been listening to this, then you know what? I want you to give me a call. Give me a call as soon as possible so I can get you checked out to see if you have any types of injuries. That's it for today. Thanks for listening, and congrats on finishing my first health alert on Whiplash. I'll see you soon.